Finally.
The sponsor yields.
Thank you, Mr. Gottfried. On page 5 of the bill, line 20, that's the section 3362 for lawful use. I just have a question about section 3 there. That's saying it shall be lawful under this article to give or dispose of marijuana obtained under this title for certified medical use between certified patients and other certified patients, and between a designated caregiver and the designated caregiver certified patient, where nothing of value is transferred in return, or to offer to do the same. And am I reading that? Is that mean what it says? I asked that from being in the Assembly now for a few months. I know sometimes it's being suggested that they don't mean exactly how it reads.
I think it means what it says. Basically, it is designed so that two patients would be able to offer one another their product. A designated caregiver would be able to provide it to a patient. One designated caregiver could give it to another, as long as no money is changing hands. And technically you need to provide that, because under our law, any transfer of possession is technically a sale, whether money changed hands or not.
And that's my understanding as well. Under the penal law, any other controlled substance that's given to a party would ultimately could result in a criminal prosecution. In fact, would be felony, sale third, just for giving a controlled substance, even if the recipient of that particular substance is someone who possesses a prescription for the same drug, right? Isn't that accurate?
Right.
So my question is, why do we feel the need for this for medicinal use? And I mean, at this point, I'm convinced there certainly are very valid medicinal uses for it. So why are we treating this differently than other types of substances that are certainly controlled by the FDA and controlled by pharmacies and physicians?
Well, unlike probably the vast majority of other prescription drugs, if you wouldn't want one person saying to another person, here, try my penicillin pills, because there can be very serious side effects. Too much of a great many otherwise innocuous prescription drugs can cause serious side effects or kill you. With medical use of marijuana, you have almost none of that kind of concern. And so if one cancer patient shares his or her medical marijuana with another cancer patient, there's almost no possibility for a downside risk there.
And I guess that's the one remaining wrinkle that I have, is that the almost no downside versus surely no downside to allowing patients to essentially prescribe to each other, even though they're certified patients. I guess that's the one remaining wrinkle that I would suggest that we iron out. And is that in the Senate bill as well, that they allow patient-to-patient distribution? Do you know?
I'm sorry, I can't hear you. Could you say that?
I'm sorry. Do you know if the Senate bill contains a provision allowing patient-to-patient distribution?
As far as I know, on this paragraph does appear in Senator Savino's bill.
Okay. Thank you, Mr. Gottfried. And on the bill, very briefly.
On the bill, Mr. Palumbo.
Thank you, Mr. Speaker. I think that we're making progress toward an appropriate statute that would control the distribution of marijuana for strictly medical purposes, but we're not there yet. We have a few reprints. There are multiple versions out there, but I'm very hopeful, as are some of my colleagues, as was mentioned in the debate today, that we can finally get to a final draft that will keep it appropriately limited to avoid some of the pitfalls that are of great concern to many constituents. Thank you again.